patient today asked about depression. They said that everything in their life was actually going really well. They were in a happy relationship. They recently had a promotion at work. Their family was doing well. And yet they were having a hard time really enjoying time with family, time with friends. They were finding that they were going out of their way to isolate at home, spending increased time indoors. They were feeling tired, sluggish all the time, poor concentration, poor memory. They were more critical of themselves. But they didn't understand, how could this happen? When I brought up that it's possible they were having a depressive episode, they said, oh, that's really impossible. I've never been a depressed person. I've always been a happy-go-lucky kind of a guy. And so I couldn't actually have major depressive disorder or a depressive disorder. And what's interesting about this in one way, but also really can be confusing for people and distressing for people, is that the reason why mood disorders like major depressive disorder are disorders are because in some ways they really don't make sense. So in this case, someone who has always been pretty happy-go-lucky, who a lot of things in their life, their family, their job, their relationship are all going well, they still find that they're struggling with the way that they feel and they're struggling with their emotions. And that's, again, exactly why what we're talking about here is a disorder, because when someone has a mood episode, it often is in conflict or really doesn't make sense given the person's actual reality. And that's, again, why it's a disorder and why it's a medical condition. And again, depression, mood disorders, and anxiety disorders are treatable medical conditions. And if you feel that this video pertains to you in any way, please be sure to reach out to a mental health provider.